Part A. Extract 1. Questions 1 to 12. You hear a pulmonologist talking to the mother of a 5-year-old called Mihiraa. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. So, you've brought your daughter in today because of...
Doctor. She's been snoring quite loudly at night for the past few months. It's gotten so bad that it's even disrupting my husband's sleep.
I see. Mihiraa, can you describe it in more detail? Is it constant or does it come and go?
It's more like a rumbling sound, and it happens throughout the night.
Anything else have you noticed, Mihiraa?
Sometimes she seems to gasp for air while sleeping.
Have you tried any remedies at home, Mihiraa, to address it?
Yes, we do. We have tried raising the head of her bed, using a nasal decongestant spray, and even limiting her screen time before bed, but nothing seems to work.
I understand, Mihiraa. Now, has Mia had any other recent health concerns, like allergies, frequent colds, or ear infections?
Not really. She's generally a healthy child, except for the occasional sniffles.
Good to hear, Mihiraa. And is there any family history of sleep disorders?
My husband has bruxism. Other than that, no one else in the family has any sleep issues.
Okay, and how would you describe Mia's growth and development? Mihiraa, is she within the normal range for her age?
I think so. She's always been a bit on the smaller side, but her pediatrician has never expressed any concerns about her weight or height.
Have there been any recent changes in Mia's lifestyle or routine that might be contributing to the condition, like starting school or new allergies?
Not really. Everything's been pretty consistent, doctor.
Well, Mihiraa, based on what you've described, there are a few possibilities for her condition. It could be related to enlarged tonsils or adenoids, allergies, or even a condition called sleep apnea.
What's that?
It is a disorder, Mihiraa, where breathing briefly stops and starts during sleep, that is periodic breathing. It can cause her symptoms and even daytime sleepiness.
Oh my, that sounds serious. What can we do about it?
Mihiraa, first, we need to do a more thorough examination of Mia, including checking her ears, nose, and throat. We might also recommend a sleep study to get a clearer picture of what's happening during her sleep.
Okay, that makes sense, doctor. What else can we do in the meantime? Are there any home remedies that might help?
While we wait for the results of the tests, there are a few things you can try at home, Mihiraa. Keeping her bedroom cool, and I recommend using a humidifier at night to keep the air moist, maintaining a regular sleep schedule, and avoiding heavy meals before bed can all be helpful.
Thank you, Dr. Muller. I appreciate your advice and the reassurance. We'll definitely follow your recommendations and look forward to the next steps.
You are welcome, Mihiraa. I'm confident we can get to the bottom of this and help Mia get a restorative sleep again.
Extract 2. Questions 13 to 24. You hear a psychiatrist talking to a patient called Mihiraa. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat. It's good to see you again. How have you been since our last visit a month ago?
Honestly, doctor, it's been a bit of a roller coaster. There have been good days and bad days.
I understand, Mihiraa. Can you tell me more about the good days? What were they like?
Well, there were days when I felt more in control of my anxiety. I could manage my thoughts better, and even socialize without feeling overwhelmed.
That's fantastic, Mihiraa. What about the bad days? Did you notice any changes in your symptoms?
Unfortunately, yes. Sometimes the anxiety feels even more intense than before. My heart races, my palms sweat, and I get this tightness in my chest. It's like I'm suffocating.
I see. Did you identify any specific triggers for these episodes, Mihiraa?
Well, work deadlines definitely make it worse. And sometimes, even crowds or loud noises can send me spiraling.
Thank you for sharing that, Mihiraa. Now, tell me about your lifestyle changes. Have you been able to implement the relaxation techniques we discussed?
I've been trying. I do deep breathing exercises every day, and I try to meditate before bed. It helps sometimes, but not always.
That's commendable, Mihiraa. Consistency is key. Have you noticed any improvement in your sleep quality?
Actually, yes. I'm falling asleep faster and waking up feeling more rested.
Excellent. That's a positive sign, Mihiraa. Now, regarding your medication, have you been taking it as prescribed?
Yes, doctor. I've been diligent in adhering to every prescribed dose without fail.
That's good to hear. Mihiraa, based on what you've shared, it seems you're making progress, but there are still some challenges we need to address.
I agree, doctor. I want to feel more in control of my anxiety and live a normal life.
I understand your desire, Mihiraa. To help you further, I'd like to suggest some additional remedies. We can explore cognitive behavioral therapy techniques to manage your thought patterns and anxiety triggers.
I've heard about it, but I wasn't sure if it would be right for me.
It can be highly effective in managing anxiety. It equips you with tools to identify and challenge negative thought patterns that contribute to your anxiety. We can discuss it further if you're open to it.
I'm willing to try anything that might help.
Absolutely. I'd suggest considering joining a support group for individuals experiencing anxiety. Mihiraa, engaging with peers who share similar experiences can provide invaluable support and validation. Moreover, it's an opportunity to learn coping strategies and gain insights from others' journeys, which can complement any medical or therapeutic interventions you're undertaking.
That sounds interesting. Where can I find such a group?
Certainly. I can furnish you with some resources and contact details. Moving forward, Mihiraa, I recommend scheduling a follow-up appointment in 2 weeks to conduct a reassessment of your progress and make any necessary modifications to your treatment regimen. This will allow us to ensure that you're on track with your medical management and address any emerging concerns promptly.
Okay, doctor. Thank you for your time and support. I feel more hopeful now.
Absolutely, Mihiraa. Please remember that you're not navigating this journey alone. We're here to provide unwavering support as you progress toward recovery, employing evidence-based interventions tailored to your specific needs.
That is the end of Part A. Now check the answers.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.